All right, everybody, ready for another deep dive? Today we are going to be breathing easy as we take a deep dive into your lungs.
Lungs.
Yeah, we've got Dr. Clarkson's medical school lecture all queued up on pulmonology, and trust me, this is way more interesting than it sounds.
Yeah.
By the end of this, you'll practically be speaking fluent lung.
It's really fascinating stuff.
So let's start with the basics. Like, how do we even know that something might be off with our lungs? What are some of the signs and symptoms that we should be looking out for?
Well, there are some obvious ones, like coughing up blood,
Yeah.
which is never a good sign. That's hemoptysis, by the way.
Hemoptysis, got it. Write that down, folks.
You know, but there are also some more subtle signs.
Like what?
Well, have you ever noticed your fingers turning blue in the cold?
Oh, yeah, all the time.
Yeah. So that's called peripheral cyanosis, and it's often just due to poor circulation.
Okay.
But if your lips or tongue turn blue, that's central cyanosis. And that could signal a problem with your heart or lungs' ability to deliver oxygen.
Okay, so blue lips, bad news, got it.
Exactly.
Now, what about this thing called clubbing? I've heard that it's more than just a manicure issue.
Yeah, clubbing is when your fingertips become rounded and bulbous.
Okay.
And it can actually be a sign of any long-term condition that's causing low oxygen levels in the blood.
Wow. So your fingernails can actually reflect what's happening deep inside your body.
Isn't that wild?
That is wild. Okay, so we've got blue lips, clubbed fingers.
Yeah.
What about breathing patterns? Dr. Clarkson mentioned some unusual ones, like Kussmaul's breathing. Is that just like being out of breath after a workout?
No Kussmaul's breathing. It's this really rapid, deep breathing pattern. It's often seen in diabetic ketoacidosis, which is a serious complication of diabetes.
Okay.
And then there's there's Cheyne-Stokes breathing.
Cheyne-Stokes?
Yeah, it's even more concerning.
Okay.
This is this cycle of fast breathing followed by periods of no breathing at all.
Oh, wow.
And it could be a sign of sleep apnea or even coma.
So I'm officially paying way more attention to my breathing now.
Good idea.
Okay, so we've talked about some of the external signs, but what about what's actually happening inside the lungs? You know, Dr. Clarkson mentioned this thing called ventilation-perfusion mismatch, or VQ mismatch. It sounds pretty complicated.
Yeah, it is a bit of a mouthful.
Yeah.
But think of it this way. You've got air flowing in and out of your lungs, that's ventilation.
Okay.
And then you've got blood flowing through your lungs to pick up oxygen, that's perfusion.
Okay.
And ideally, you want these two things to be in sync.
So like a perfectly choreographed
Exactly. But when they're out of sync, you get a VQ mismatch. And that's when things can start to go wrong.
So what can go wrong?
Well, imagine your blood flowing past air sacs that aren't getting enough air.
Okay.
That's a low VQ mismatch.
Low VQ mismatch, got it.
And it can be caused by things like a collapsed lung or asthma or pneumonia.
Okay, so what would be a high VQ mismatch then?
So that's when you have plenty of air, but the blood isn't flowing properly to pick it up. And this is where pulmonary embolism, or PE, comes in.
The PE, oh yeah, the one they warn you about on long flights. Isn't that a blood clot that travels to the lungs?
Yeah, exactly. And, you know, they're more common than you might think.
Really?
About 90% of the time, those clots actually start in the deep veins of your legs or pelvis.
Oh, wow.
That's called deep vein thrombosis, or DVT.
Okay, so if you're on a long flight and your leg starts to hurt.
Yeah, exactly. So if you're experiencing leg pain, swelling, or redness,
Yeah.
especially after a long flight or a period of immobility,
Yeah.
you know, don't mess around, get it checked out.
Noted.
Yeah.
Okay, so we've got low VQ, high VQ blood clots on the loose. What else can go wrong with our lungs?
Well, you know, we can also run into problems with how the lungs themselves are working.
Okay.
Some conditions make it hard to get air out. Those are obstructive lung diseases.
Okay.
Others make it tough to get air in.
Okay.
Those are restrictive lung diseases.
So obstructive is like trying to blow through a straw.
Right.
And restrictive is like trying to inflate a stiff balloon.
Perfect analogy.
Okay, perfect.
So classic obstructive diseases include COPD, emphysema, and asthma.
Okay.
Restrictive ones can be caused by things like pulmonary fibrosis, obesity, or even just a collapsed lung.
Got it. Okay, so let's talk about some of these specific conditions then. Asthma. I feel like everyone knows someone with asthma, right?
Yeah, it's incredibly common.
Yeah.
And it's all about inflammation and constriction in the airways.
So what triggers these airway meltdowns?
Well, it can be a whole host of things, you know? Pollen dust mites, smoke pollution, even exercise or stress can set it off.
Really?
Yeah, and when those triggers hit, your body releases all these inflammatory chemicals that make your airways swell and spasm.
Wow.
That's why you feel that tightness in your chest and struggle to breathe.
And that's where those inhalers come in.
Exactly. Albuterol, a common asthma medication, works by relaxing the muscles around your airways,
Okay.
opening them up so you can breathe easier.
Okay, so it's like a magic wand for your lungs.
Kind of.
But I've heard it can make your heart race.
Yeah, that's true. Albuterol can sometimes affect the heart because it acts on receptors that are also found there.
Okay.
It's usually not a big deal, but something to be aware of.
Good to know. Okay, so we've got asthma covered. What about COPD?
COPD, or chronic obstructive pulmonary disease, that's a whole other beast.
Okay.
It's a chronic progressive disease that includes both chronic bronchitis and emphysema. And the number one cause,
Let me guess.
smoking.
Smoking figures.
Yeah, smoking disables your lungs' natural defense system,
Yeah.
making them vulnerable to irreversible damage.
Okay, so with COPD, you're basically fighting an uphill battle against your own lungs.
Pretty much.
Okay, so chronic bronchitis is all about chronic inflammation and mucus production in the airways.
Right. It's like having a perpetual chest cold.
Ugh.
In fact, Dr. Clarkson actually used the term blue bloater to describe folks with chronic bronchitis.
Blue bloater.
Yeah.
That's descriptive.
It is. They get the nickname blue because they often have low blood oxygen levels, which gives their skin a bluish tint. And bloater refers to the swelling they often experience in their legs and ankles due to heart problems.
Wait, heart problems, but we're talking about lungs here.
Right, but remember, it's all connected when your lungs are constantly struggling to get air in and out.
Yeah.
It puts a strain on your heart, which can lead to right-sided heart failure,
Okay.
also known as cor pulmonale.
Poor pulmonale.
Yeah, it's a pretty serious complication.
Okay, so chronic bronchitis, bad news.
Yeah.
What about emphysema? Is that the same thing?
Not quite. Emphysema is all about the destruction of the alveoli, those tiny air sacs in your lungs where gas exchange happens.
Oh, okay.
So imagine those little balloons we talked about earlier getting popped one by one.
Oh, that sounds terrifying.
It's not a pretty picture.
So what happens when those air sacs are gone?
Well, it becomes really hard to exhale fully because your lungs have lost their elasticity.
Okay.
Think of it like trying to squeeze air out of a limp balloon.
Okay.
It's just
Yeah.
not going to happen.
So they can't get the old air out, which means they can't get fresh air, and that's got to be exhausting.
Exactly, and that's why people with emphysema often develop a barrel chest.
A barrel chest.
Yeah, from their lungs being constantly hyperinflated.
Wow. And Dr. Clarkson called them pink puffers.
Pink puffers, yeah.
So pink because their blood oxygen levels are okay.
At least in the early stages.
Okay.
And puffers because they tend to breathe through pursed lips to try and force air out.
Pink puffers and blue bloaters. I'm starting to see a theme here with these colorful nicknames.
They do paint a vivid picture.
They really do. Okay, so we've got these two very different conditions under the umbrella of COPD. What else can go wrong with our lungs?
Well, sometimes it's not about lifestyle choices like smoking, but about our genes. Cystic fibrosis, for example, is a genetic disorder that affects multiple organs, but it really wreaks havoc on the lungs and pancreas.
I remember learning about cystic fibrosis in school. It's caused by a mutation in a gene that controls salt and water balance in the body, right?
That's right.
And one of the things that always struck me about cystic fibrosis is that one of the signs is salty skin. What does that have to do with the lungs?
It all goes back to that faulty gene. You see, it affects chloride channels, which are involved in transporting salt and water across cell membranes.
Okay.
So in sweat glands, these channels are supposed to reabsorb chloride, but in cystic fibrosis, they can't do their job properly. So more chloride, along with sodium, gets excreted in sweat, making the skin taste salty.
That is so bizarre and fascinating at the same time.
I know, right?
So the same chloride channel dysfunction that causes salty skin also messes with the lung.
Exactly. In the lungs, that thick, sticky mucus builds up and clogs the airways, making it hard to breathe and increasing the risk of infections. And because the mucus is so difficult to clear, it creates this vicious cycle of inflammation and damage that can eventually lead to serious complications.
Dr. Clarkson mentioned that people with cystic fibrosis often struggle with recurrent lung infections, especially from a bacteria called Pseudomonas aeruginosa. It sounds like a constant battle.
It is. But thankfully, treatments for cystic fibrosis have come a long way.
Oh, that's good.
The median survival age is now 50 years.
Wow.
And some people are even living into their 80s.
That's incredible.
It really is.
Okay, so we've talked about a lot of lung conditions that are caused by bacteria, viruses, or even our own genes. But what about things we encounter in our everyday lives? Like, can you actually get sick from breathing in stuff that's floating around in the air?
Absolutely. Remember tuberculosis or TB?
TB. Oh, yeah.
That's an airborne infection that's been around for centuries.
Yeah.
and it's still a major global health problem.
Yeah, that's the one they used to call consumption, right? Because it made people waste away?
That's the one. And it's caused by a bacterium called Mycobacterium tuberculosis,
Mycobacterium tuberculosis.
which can hang out in the air for hours just waiting to be inhaled by an unsuspecting victim.
So if you breathe in those TB bacteria, you're automatically doomed?
Not necessarily. There's a difference between latent TB and active TB. In latent TB, the bacteria are in your body, but they're just kind of hanging out, not causing any symptoms. You're not contagious, and you might not even know you have it. But in active TB, those bacteria are multiplying and wreaking havoc on your lungs.
Okay.
That's when you get the cough, fever, weight loss, and all the other nasty symptoms.
So it's like a ticking time bomb in your lungs.
Kind of, yeah. And the scary part is that TB can affect other organs besides the lungs. It can spread to your kidneys, your spine, even your brain.
Oh, yikes. Okay, so how do you know if you have this TB time bomb lurking in your body?
Well, there are a couple of tests that can detect TB infection.
Okay.
There's the Mantoux skin test, also known as the PPD test,
Mm.
where they inject a little bit of TB protein under your skin and see if you react to it.
Okay.
And there's the IgRA blood test, which looks for specific immune cells that are activated by TB.
So if one of those tests comes back positive, does that mean you've got full-blown TB?
Not necessarily. It just means you've been exposed to the bacteria at some point in your life.
Okay.
You could have latent TB, which is treatable, or you could have active TB, which requires more aggressive treatment.
Okay.
And to figure that out, you'll need a chest x-ray and maybe some other tests to see if there's any damage to your lungs.
Okay, and let's say you do have active TB. What's the treatment like?
It involves a cocktail of antibiotics taken for several months, sometimes up to a year or two.
Wow.
And it's super important to take all the meds as prescribed because TB bacteria are notorious for developing resistance to antibiotics.
Okay, so no skipping doses or sharing meds with your friends no matter how much they're coughing.
Exactly. And speaking of coughing, let's talk about a condition that can be pretty dramatic, pneumothorax.
Pneumothorax.
Yeah, this is when air gets into the pleural space,
Hmm.
which is the space between your lungs and your chest wall.
It's like a pop tire.
Perfect analogy.
Okay.
And just like a cop tire, pneumothorax can make your lung collapse.
And there are different types of pneumothorax, right? Dr. Clarkson mentioned something about attention pneumothorax, which sounded pretty scary.
It is scary. Attention pneumothorax happens when air gets trapped in the pleural space and can't escape,
Mm.
putting pressure on your lung and even pushing your heart and other organs out of place.
Oh my gosh.
Yeah, it's a true medical emergency.
That sounds terrifying. What causes a pneumothorax in the first place?
Sometimes it happens spontaneously, especially in tall, thin people, when a small air sag on the surface of the lung ruptures.
Okay.
Other times it can be caused by trauma, like a rib fracture or a stab wound, which creates an opening for air to rush in.
So if you suddenly start having chest pain and shortness of breath, especially after an injury, it's time to head to the ER.
Absolutely, time is of the essence with pneumothorax, especially attention pneumothorax.
Okay, I'm adding pneumothorax to my list of lung conditions that make me want to stay wrapped in bubble wrap. What other lung weirdness did Dr. Clarkson talk about?
Well, he touched on a bunch of other conditions, like coccidioidomycosis.
Coccidioidomycosis. Try saying that 5 times fast.
Yeah, that's a mouthful. It's a fungal infection you can get from breathing in spores in the soil, particularly in the southwestern U.S. It's often called valley fever.
Valley fever, huh? Sounds like something out of a Western movie.
It does, doesn't it? And it can cause flu-like symptoms,
Hmm.
but sometimes it can be more serious.
Okay. What else?
He also mentioned bronchiectasis,
The bronchiectasis.
which we talked about a little bit in the context of cystic fibrosis.
Yeah.
It's basically a permanent widening of the airways due to chronic inflammation and damage.
So instead of those nice smooth tubes, your airways look more like bumpy, distorted tunnels.
Exactly, and those bumpy tunnels trap mucus, making it even harder to clear and creating a perfect breeding ground for infections.
Ugh, sounds delightful. Anything else I should be adding to my lung nightmare list?
Well, there's atelectasis, which is basically a collapsed lung.
Oh, great.
It can happen after surgery from a blockage in the airway, or even just from not taking deep breaths for a long time.
So I should probably take a deep breath right now just to be safe.
Good idea.
Okay.
And finally, there's pulmonary fibrosis, which is basically scarring of the lungs.
Okay.
This can make your lungs stiff and less able to expand, making it really hard to breathe.
And what causes that?
It can be caused by a bunch of things, like exposure to certain toxins, autoimmune diseases, or even certain medications, and sometimes the cause is unknown.
Okay. I'm officially convinced that our lungs are delicate little snowflakes that need to be protected at all costs.
I think that's a great takeaway, but before you start living in a hermetically sealed bubble.
Yeah. Let's take a quick break to catch our breath. We'll be back in a moment to recap what we've learned and talk about some ways to keep those delicate snowflakes healthy and happy.
Sounds good.
Wow.
That was a lot to take in.
Yeah, our lungs are pretty complicated.
They really are, but it's good to know what we're working with here. So
Exactly.
maybe we should do a quick recap just to make sure we're all on the same page.
Sounds good to me. Okay, so we started by talking about some of the signs and symptoms that something might be wrong with our lungs, like blue lips and clubbed fingers. Those are signs of low blood oxygen levels, right?
Right, and remember those weird breathing patterns like Kussmaul's and Cheyne-Stokes?
Oh, yeah. Those are definitely not good.
Not good at all. They can be signs of some pretty serious conditions.
Okay, and then we talked about ventilation and perfusion and how important it is for those two things to be in sync.
Right, like a perfectly choreographed dance.
Exactly. But when they're out of sync, you get that VQ mismatch, which can cause all sorts of problems.
Yeah, and we talked about the different types of VQ mismatch. Low VQ, where the air isn't getting to where it needs to go.
Like in a collapsed lung or pneumonia?
Exactly, and then there's high VQ,
Yeah.
where the blood flow is compromised.
Like in a pulmonary embolism.
Right, and remember those blood clots often start in the legs. So if you're experiencing leg pain, swelling, or redness, don't ignore it.
Noted.
Good. And then we moved on to those broader categories of lung diseases, obstructive and restrictive.
Right, obstructive is like trying to blow through a straw, and restrictive is like trying to inflate a stiff balloon.
Perfect analogies.
And then we got into some specific lung conditions, starting with asthma, which is super common.
Yeah, it's all about inflammation and constriction in the airways.
And we talked about all those different triggers, from pollen to dust mites to even stress.
Right, and how those triggers can cause your airways to swell and spasm, making it hard to breathe.
And then we talked about COPD, which is a whole other beast.
Yeah, COPD is a chronic progressive disease that includes both chronic bronchitis and emphysema.
And I'm never going to forget those colorful nicknames, blue bloater for chronic bronchitis and pink puffer for emphysema.
Those nicknames definitely make them easier to remember.
They really do. And they also highlight the fact that COPD is not a single disease, but a spectrum of conditions with different underlying mechanisms.
Exactly. Chronic bronchitis is all about inflammation of mucus, while emphysema is all about the destruction of those tiny air sacs, the alveoli.
And then there's cystic fibrosis, that genetic disorder that can cause so many problems.
Yeah, it all comes down to a single gene mutation that affects chloride channels in the body.
And we learned how that mutation can lead to everything from salty skin to thick, sticky mucus in the lungs to problems with the pancreas.
It's amazing how one tiny mutation can have such a wide-ranging impact.
It really is, but thankfully, treatments for cystic fibrosis have come a long way.
They really have.
Okay, and then we moved on to pneumonia, which I think a lot of people underestimate.
Yeah, it's easy to think of it as just a bad cold, but it can be a lot more serious than that.
Right, it's actually a leading cause of death worldwide.
And it's not just one thing. It's a whole family of infections that can be caused by bacteria, viruses, or even fungi.
And we talked about how pneumonia is basically like your lungs drowning from the inside out.
Yeah, as those tiny air sacs fill up with fluid and pus, it makes it really hard to get enough oxygen.
And then there's tuberculosis, or TB, which is an airborne infection that's been around for centuries.
Yeah, TB is caused by a bacterium that can hang out in the air for hours just waiting to be inhaled.
And we talked about the difference between latent TB and active TB.
Right, in latent TB, the bacteria are just dormant in your body, not causing any problems. But in active TB, those bacteria are multiplying and causing all sorts of damage.
And TB isn't just a lung disease. It can affect other organs too, like the kidney, spine, and even the brain.
So early detection and treatment are really important.
Absolutely. And then there's pneumothorax. That's the one where air gets into the space between your lungs and your chest wall.
Right, like a pop tire.
And it can cause your lung to collapse.
And we talked about how a tension pneumothorax is a real medical emergency.
Yeah, that one's definitely not something you want to mess around with.
Nope.
Okay, so those are some of the major lung conditions that we covered, but Dr. Clarkson also mentioned a few other interesting ones like valley fever.
Yeah, valley fever or coccidioidomycosis is a fungal infection you can get from breathing in spores in the soil in certain parts of the U.S.
Most people don't have any symptoms, but some people get flu-like symptoms, and in rare cases, it can be more serious.
So be careful what you breathe.
Exactly.
And then there's bronchiectasis, which we talked about a little bit earlier. Remember, that's when your airways become permanently widened and damaged.
Yeah, making it hard to clear mucus and increasing the risk of infections.
Right, those airways end up looking like bumpy, distorted tunnels instead of nice, smooth tubes.
And then there's atelectasis, which is a collapsed lung.
It can happen for a variety of reasons, from surgery to blockages to simply not taking deep breaths for a while.
So everyone listening, take a deep breath right now.
Good idea.
And finally, there's pulmonary fibrosis, which is basically scarring of the lungs.
This can make your lungs stiff and less able to expand, making it really hard to breathe.
And it can be caused by all sorts of things, from toxins to autoimmune diseases to certain medications.
Right, and sometimes the cause is unknown.
Wow, so many ways our lungs can be compromised. It's like they're under constant attack.
It really is, which is why it's so important to take care of them.
Okay, so now that we've reviewed all the ways our lungs can go wrong, let's talk about how to keep them healthy.
Sounds good to me.
All right, so we've spent a lot of time talking about what can go wrong with our lungs.
Yeah, it's a lot to digest.
Yeah, it really is. But knowledge is power, right?
Absolutely.
So now that we know all about these lung conditions, how can we actually protect ourselves? What can we do to keep our lungs healthy?
Well, a lot of it comes down to common sense.
Oh,
If you smoke, quit.
okay.
Seriously. It's the single best thing you can do for your lungs.
I think we can all agree on that one.
And it's not just cigarettes, vaping, secondhand smoke, all of it. It's bad for your lungs.
So ditch the smokes. Check. What else?
Be mindful of your environment.
What do you mean?
Air pollution.
Oh, yeah.
That's a major lung irritant.
Yeah.
So, if you live in a city or an area with poor air quality, check those air quality reports before you head out for a run.
Okay, so maybe opt for an indoor workout on bad air days.
Exactly.
Okay, anything else I should be avoiding?
Well, certain jobs carry a higher risk of lung disease,
Like what?
like coal miners, construction workers, even hairdressers and nail technicians who work with a lot of chemicals.
Oh, right, because of all the fumes and dust?
Exactly. If you work in one of these fields, make sure you're using proper protective gear, like masks and respirators.
Safety first.
Exactly.
Okay, so we've got the don'ts. What about some proactive things we can do to boost lung health?
Well, exercise is a great one.
Okay.
Getting your heart rate up strengthens your lungs and helps them work more efficiently. Even moderate exercise like brisk walking or cycling can make a big difference.
I like the sound of that. What about diet? Any lung-loving foods we should be stocking up on?
There's no magic bullet food, but a balanced diet, rich in fruits, vegetables, and antioxidants is always a good idea.
Okay.
And staying hydrated is key, too. It helps thin out mucus and makes it easier to cough up,
So basically all the things our moms have been telling us to do our whole lives.
pretty much.
Eat your veggies, drink your water, and exercise.
Exactly. It's not rocket science. But those simple lifestyle choices can make a big difference.
Good to know. Okay, so we've got the lifestyle stuff covered. What about the medical side of things? Are there any screenings or tests we should be getting regularly to catch lung problems early?
It's always best to talk to your doctor about what's right for you based on your individual risk factors and health history.
Of course.
But in general, if you're a smoker or a former smoker, your doctor might recommend regular lung cancer screenings.
Okay, what about for those of us who haven't been smoking? Is there anything we should be asking our doctors about?
Yeah, if you're experiencing any persistent respiratory symptoms like a cough that won't quit, shortness of breath, or wheezing, definitely bring it up with your doctor.
Okay.
They might recommend some lung function tests.
So basically, if your lungs are talking, listen to them.
Exactly. Early detection is key.
Well, this has been a fascinating and slightly terrifying deep dive into the world of pulmonology.
It's a lot to take in.
Yeah, it really is. But I feel like I've learned so much from just one medical school lecture.
Me too. Dr. Clarkson really knows his stuff.
He really does. So to recap, ditch the smokes, be mindful of your environment, get moving, eat your greens, drink your water, and listen to your body.
Simple but effective.
All right, folks, that's all the time we have for today's deep dive into pulmonary pathology.
Thanks for joining us.
And remember, breathe easy.